everybody, it is our Friday Live. I'm Dr. Ange.
I'm Dr. James.
And today we're going to be talking to you about one of the most common questions we get about a really big population of people we actually see in the practice, and that is about infants. So a lot of people ask us why an infant may be receiving chiropractic care or why they may be getting adjusted, and that's what we're going to be talking to you about today.
Yeah, so to start with, when we're looking at this age range, we've got to start right at the beginning. So the birth process itself, that itself is often, there is some trauma involved with that. It doesn't matter on the style of birth, C-section, vaginal delivery, posterior, there's some trauma involved. So that is step one, and that can then lead on to some ongoing issues where if there is trauma involved, where if you end up with a shoulder or a neck issue and they're not addressed, you can end up with issues around being able to feed, latching.
Yeah.
Then if it is left unaddressed longer term, you end up with positional issues as well, where a kid is less likely to want to turn the head a particular way, so they stay in this position all the time. They end up with a flat spot on the back of the head, called plagiocephaly, which we've talked about in the past. Now we go back to the idea of the latching issue and feeding. It can then lead on to issues around colic as well, which means you've got the unsettled baby,
which may not be sleeping well.
And that can be extremely stressful for parents as well. So that's definitely kind of in the top few there for me.
And then leading on from that, when sometimes you see issues in those areas, that can have a really big effect on development and hitting those milestones in the first year of life.
Yeah, there's so many things that go on in that first year of life. So even if it's something as simple as an uncomfortable wrist, it will stop a baby from wanting to push up. It might want to stop them from rolling over or getting up to the hands and knees to start crawling. So simple things like that can actually affect how a child is willing to get up and start moving. So then achieving their gross motor milestones are affected as well.
Yeah, and so while there are a lot of studies about the efficacy of chiropractic care in relation to these different conditions when we compare it to other modalities, there's actually studies, or a study in particular that's been done, that's shown mothers and their interpretation on the conditions that their baby may be experiencing, and it actually looked at before and after a trial of chiropractic care, and they actually found lots of positive benefits from receiving the chiropractic care. And while we know that we definitely still need more research and definitely a bigger study cohort based on this study in particular, it's a really positive and encouraging change.
Absolutely.
Yeah.
So with so many things going on in that first year of life, it's really important that we're functioning to our full potential. So with that in mind, if you're curious about how chiropractic care could help you, your child, or maybe one of your loved ones and their children, why not give us a call, come in and have a chat to us and see how we're able to help you out. Otherwise, guys, wish you all a wonderful week, and we'll see you all next time.
Thanks, everyone. Bye.
See ya.